Hi, I'm Chris Urquhart, publisher of Natural Awakenings magazine, and I'm here today with Dr. Steve Alukonis of Space Coast Advanced Health, and we're here to bring you some positive news of things you can do to help yourself today stay healthy. So thank you for joining us, Dr. Alukonis. Just as a brief introduction, I want to let you know that he is a chiropractic orthopedist who is specially trained in 9 different chiropractic adjusting techniques, and he also practices functional medicine. So thank you so much for joining us, and I want you to just go ahead and get right to it. What are you seeing in your office right now, and what are you doing that you can help people just stay healthy right now during this time when we're all looking for that?
Okay, that's great. This is what we're doing. We are still busy. I know places and businesses are not operating, but we are. And we are still every single day getting a lot of new patients and our regular patients. Our regular patients understand the benefits that we can provide to help build up their immune system so that way they could stay as healthy as possible because of this virus that we're dealing with. So that's on everybody's mind. We keep the office extremely sanitized. There's big notes on the window and the door, front door, saying as soon as you walk in this office, we want you to go to the bathroom, wash your hands. We sanitize everything in the entire office. You know, we use alcohol. Even if I'm wearing gloves, I wipe down alcohol on my gloves between patients. No one's had a complaint. No one's had a problem. And if anybody is remotely sick, like say they think they're getting a cold, we ask them, don't come in, just don't come in. So everybody that's coming in at this point have been healthy. So what we do is I want to put the connection together, and I want to make it so clear that your audience, your clientele that's watching this can appreciate it and utilize it. All right, because it's not always good to just walk into a health food store and ask a clerk, what should I be taking? Because they're not educated enough. You know, I have 18 years, I have 35 or 40 years of nutrition training. So that's how far back I go. But I have 18 years of functional medicine training, which utilizes all sorts of nutritional companies that specialize in keeping the body healthy. Not like giving you just one vitamin. Like they don't just give you vitamin E or vitamin C. They have 130 scientists, researchers, nutritionists, 130 on their staff. That all they do all day is research and development for different health conditions that we have common, whether it's autoimmune, whether it's a bad immune system, gut. So that's what I want to get into.
So real quick, functional medicine, for those who may not know, its whole basis is getting to the root of the problem so that you can make lifestyle adjustments and resolve your disease or whatever it is that you're working on. Is that correct?
Yeah. Yes. And just to add to that, and then I'm going to get back into the chiropractic end of it too. What we do is we do extensive blood testing. Most of the time I see very basic testing from most of the doctors out there. That's just the training. They do basic. I usually find the root of the cause in extensive blood work. A lot of times I find autoimmune conditions that are not found, thyroid conditions that are autoimmune. So I pick up a lot of things from having extensive panel. The other thing we do is we do a live blood analysis, red blood cells. We do a finger prick, put blood on a slide. We look on a big screen with the patient, and we can see that they might have overgrowth of yeast in their gut, bad bacteria that's overgrown, parasites. So basically, it's taking over your good bacteria, your good flora in your gut. So the reason I'm saying that's so important is your gut is where at least 70% of our immune system lives. I mean, if you think about it, if I said to anybody on the street, where is your immune system mostly? Nobody knows. I've asked.
You might guess lymphatic or something like that. Yeah.
Yeah, exactly. So they just know that they have an immune system.
Mm.
But we know, and a lot more research has come out over the last 15 years at least, maybe longer, that I've been working with this, that the gut, especially with functional medicine, the gut is the first place that I go to with patients. So we run tests to find out how healthy is the gut. And then we have specialized formulas, either powders and pills, to help get the bad stuff and replace it with all the good stuff and get it to heal the lining of the intestinal tract properly. And I'm talking in a matter of a week or two, these very sick people start to turn around and feel great. We just had one, she came in here, she was miserable. She's been sick for a long time. And a week later, she's joking, laughing. She turned into a different person, like night and day.
So we really are what we eat.
Yeah, and I do that. That's part of it. Functional medicine is changing their diet. Not diet. Well, yes, it's not a diet. It's lifestyle eating. It depends on what they're eating. Garbage in, garbage out, just like a computer. So we have all different recipes. We have a whole bunch on my website, different recipes of do's and don'ts. Eat this, don't eat that. Stay away from processed foods, eat more whole foods, and eat a lot of vegetables. Things like that to help build up their strength. So the gut is super important. Then again, here's one of the companies. This is one of the companies that we use. It's called Metagenics, and you can order this, your clients, right online through me. In other words, you cannot get it as an individual. This only is sold through doctors. But I have an account with them that patients can just go right to the site, order it, and it's delivered to them. This one's just Immunocore. So this particular supplement has various ingredients to help strengthen your immune system. So we have several different ones that we use for just the immune system, depending on what we think is going to work best. Okay. The next thing, let's just go back to what a chiropractor really does. I know most people think chiropractic is neck and back pain and headaches, just fixing things like that, pain. The current research, and I just came back from a big conference with a couple of they're neuroscientists, PhDs, that have been working on this for 15 years on how does chiropractic really work? How is this helping people with all various types of health problems, not just back pain. And what they discovered was if you have a misaligned vertebrae, even if it's a little bit, out of alignment, it tightens the muscles. That vertebrae has to send a message through your nervous system up to your brain. So we're realizing that the brain has a whole lot to do with how chiropractic works. So if it's sending up there to the brain the wrong message, a mixed message, the brain has to send messages out. So it affects your immune system, okay? Because the nervous system is your master system. If you keep it that simple, like what's the master system? Your brain and nervous system. That controls all the other systems, your digestion, okay? Circulation, it's it. So if that is not working, if your nervous system is not working at peak performance, you cannot be 100% healthy. So we always adjust patients. Every day people come in to stay healthy. They may not have pain. They may just come in just to keep themselves healthy. And they leave here, one, standing straighter, better balance. They feel like their body immediately has improved. Like they could feel the increase in health somehow. All right.
So you seeing people that are coming in more just stressed in general based on our current situation, and then do they feel calmer when you're done with them? Because does the nervous system settle down in such a way that can help us,
yeah. You want to
relax right now.
You could help me here because you're good. You hit it on the head. Yes. Again, I saw the research on this. We have equipment called, psychologists use it. It's EEG, brain waves, brain testing. Mm-hmm. So what we have done, not here, but the research, they put the EEG, these pads on their head, to test their brain, their stress level. And they found that they had high stress levels. And after the adjustment, so they would test you before the adjustment, adjust the person, and then retest them, and the stress level went way down. Their muscles became much more relaxed, and they felt much more relaxed. So that's a big part of it. And I want to compare something that I think would be helpful. When we had that last gigantic hurricane coming, right? Everybody, including me, I was extremely scared because it looked like it was going to hit us directly. And I was
the whole state, right?
Exactly. Okay. What I found was the minute the TV started showing this hurricane heading this way, every single patient, and I'm telling you, like 100% of the patients, their muscles were much more tense. They didn't know it. They didn't know it. This was, like your automatic, it's just happening to you and you don't even realize it. And the closer that hurricane came, the worse their spines and their muscles became. Soon as that passed and we were clear, immediately their muscles relaxed. It was, I've never seen it before like that. Same thing now. The more this is talked about, the virus, it's serious. Yes, they're coming in here a lot more neck pain, a lot more headaches. Their muscles, all the muscles, like your entire spine, spinal muscles, much tighter, much more tighter. They're clenching their jaw. They're having more TMJ pain. Absolutely more what we call trigger points, like all these muscles that are just below your skull, like at the top of your neck, are like rocks that I have to loosen up. So it's not always just about an adjustment. I want to point this out. When people think of an adjustment, some people come in and say, I don't want my neck adjusted. I'm afraid to have and I'm like, manually with my hands. And I go, great, no problem. That's why I have 9 techniques. This is called an activator. This is 50 years old. This research right here. This is an old technique. This stylus we put right over a vertebrae. Let you see me doing it, and then I pull the trigger, and this goes like that. See, and it helps adjust the vertebrae without any pain. I could use it on babies, and I can use it on 99-year-old people. All right, especially if women have osteoporosis. This is what I would use. Right, love it all day long. I use that. The second one that I use this one on everybody too. This I don't have it plugged in, but this is motorized. This is an adjusting technique. This goes right over your vertebrae, and this piece goes back and forth quickly, like dun, 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 like that. So it relaxes the muscle all the way down the spine. It gets each vertebrae moving correctly. No pain. People love it. Kids love it. The last thing we use, this machine, and I had to train this. I just didn't buy these. I mean, I had to go to training for like a week to learn how to use all this. This is called a percussor. This is a super strong vibration treatment that I could use over their tense, especially now. Their traps are like a rock.
Right.
Right over their traps, right over their neck, right along their spine. So all these people that are so stressed out for all the reasons, financial, not working, having to stay in the house, going, just the seriousness of it all. After they get this all done, they leave, they're a different person, And
not only that, isn't it also true that once you are aligned and the fluid in our spinal cords can flow the way they're meant to flow, that it helps the body do what it needs to do to heal itself. And if the nervous system really is the director of everything, that seems like a great root thing to do, a great starting point.
It is. And that's what we always strive, is we look, not just in chiropractic, but functional medicine's goal is look for the root cause. That's always been the chiropractic philosophy, is don't just go after a symptom. All right. There's a reason for the symptom. Okay. We look for what's creating that, whether it's a pain symptom or a balance disorder or ringing in your ears. It doesn't matter what the condition is. Our goal, where we spend our effort, is trying to look at you as the whole person, a whole body, and trying to find out what systems, not symptom, right? You got a symptom, but we look at the systems of the body and figure out which systems are not working correctly, and then fix the system. One woman, real fast, she came in, her husband carried her in. This is when I was in Cocoa Beach. All the way from Palm Bay, he drives, he carries her in the office, puts her right on the table, adjusting table. And even as a seasoned chiropractor, in my mind, I'm thinking, oh no, what am I going to do here? Because she told me she slept 22 hours a day. And she said she's up 2 hours, 1 hour cleaning, the next hour, cooking and feeding the family, right back to bed, 22 hours. This went on for years. She saw about 20 doctors over a course of at least 15 years. No one figured it out. The minute I was just listening to her, interviewing what was wrong, I just knew immediately, because really functional medicine, that it was her adrenal glands. They give you your energy. They put out cortisol. What people don't know, that their glands, they're like walnut sized. They sit on top of your kidneys. And this is also part of the immune system. So that's another reason I'm bringing this up. Well, I suspected that they were not working, or working poorly. So I ran a saliva test that I sent into the lab. Hers was flatlined. They were not working at all. So she was doomed to die in about a year. She was going to die. So no one ever brought up, not one doctor ever even mentioned adrenals. So I said, you have to go to an endocrinologist. The only way that you can get out from underneath this is you're going to have to take a small dose of prednisone, which is a steroid, small amount, every day now for the rest of your life, because your adrenals are basically gone. They're not working. And the only thing that'll stimulate them is, unfortunately, this mild, small dose of steroid. So she went to the endocrinologist. He didn't believe that she had it, because I said, you need to have this other test done to confirm it. So she said, look, just for my peace of mind, can you run the test? Well, this doctor actually called her up a few days later and kind of said, I got to kind of eat my own words, that your doctor was right and you are right. Your adrenals are not working. You need to come in immediately, like today. You need to be on this steroid. So she sleeps 8 hours a day. She's living a normal life. That's right. And yeah, she still comes in, she gets adjusted. She's always on nutrition. So we're able to maintain her health.
Right.
Okay. So yeah.
With functional medicine, the way I understand it, is that's the end goal, is maintaining the health and getting out in front of these issues so that you can improve and stay on a healthy lifestyle.
Right. Most of us, and I do mean most of us, we may start with one, small health issue, but we don't know how to handle it, and it grows, and then it starts affecting other things in your body and other systems. And next thing you know, it's gone out of control, and there's no medicine to fix it. They go to you go to your primary doctor, which I have no problem. I love that. I love medical people, and I go, of course, and if I need medicine, I get it. It's not it. Medicine, there's no like one medicine or two medicines that could get the body back into balance once it's so whacked out, when you have all these systems that are not working together. So that's why functional medicine can get, your liver detoxed, get rid of the toxins in your body, get your adrenals nice and strong, get your thyroid stronger and balanced, get your nutrients, vitamin D, 80% of us are low, even in Florida, 80%. Yeah. So, you're walking around with a bad immune system, talking about wanting to stay healthy for the virus and, for the rest of your life. Let's look at your vitamin D level. If it's low, we got to hurry up and get that up. Otherwise, your immune system is already compromised.
Right. So vitamin D is something that people can take to
they
give
have
a boost, and especially if you're not feeling well. A dose of vitamin D is something that functional medicine doctors would recommend. Isn't that correct?
Everybody needs to take vitamin D. Everybody. I don't have to always test for it. I just do it when I do my blood test to see how low it is. But because we use around 1,000 international units a day, just living. a day we lose 1,000. So if you're not replacing it, and a lot of times, of course, we don't eat perfectly, so we're not replacing it, and little by little, it starts to chip away. So everybody should be taking at least 2,000 units a day, internet IUs a day, to just maintain themselves. So depending on our blood work, sometimes we recommend 5,000 units a day. It just depends on what we find, how low it is. But an average person out there, for all of you folks, everybody, you should go, and I recommend a health food store. Nothing. I'm at a level that we find and use the top nutrient companies in the country, the top, okay? The ones that functional medicine doctors would use. The quality is better. It's made from whole foods. It's not synthetic. The potency is correct. I do not recommend buying it from like Walmart, Walgreens, places like that, because they, a lot of them are synthetic, and the quality is not nearly as good as the companies that we like to use. It's because these companies strive to get better, because they want functional medicine doctors business. They want nutrition business, right? So they want to put out the.
So they can go to a health food store, get vitamin D, or they could also, if they're coming through you on your website with the Metagenics, they can probably also.
The answer would be yes.
Do that as well.
And I personally, and I'm not pushing me or Metagenics. Trust me, I'm not. That's not my goal. But I do tell people I would rather you get it from the companies that we recommend, like Metagenics, just because it's taken me years to reach that level of research, and also seeing the difference in quality when people start getting better. We know what works, what doesn't work as good. And of course, yes, a health food store would be maybe a second choice, and getting from a good, they do have good brands. Mm-hmm. And that's what I would look for if you do go to a health food store. That way you can ask a clerk, a worker, what's like the best brand.
Right.
And try to get something that's, going to be more natural and not synthetic. But yes, everybody, vitamin D. Also right now, everybody vitamin C. Also, vitamin C keeps your immune system strong. All right. I mean, we of course, you heard what I said. We go way beyond all that, but at home, that's what I definitely recommend. And we tell everybody the same thing. Stay away from other people. Constantly wash your hands. Use alcohol, or just keep them super clean. Wear gloves and masks. Especially if you're compromised, right? If you already have a weakened system, or you have asthma, the normal things they're saying. If you're not in good health, take the precautions, because you probably do have to go to Publix or go shopping somewhere. Yeah. So cover up, wear gloves. That's what I do, because you never know who's walking by you. You don't know. Some people testing positive that don't even know they have it. We've heard stories through other patients tell us that. No patient here has had it, but outside of this office, we're hearing stories like that.
Right, and we're all hoping the tests will show up soon, so we'll know exactly who's had it and who hasn't had it. So,
yes,
you've given us a lot of really great information. I want to make sure people realize you're in Melbourne, but you also have an office in Cocoa Beach.
Yes,
you're there 2 days a week. Is that correct?
Yes, it's going to be Tuesday and Fridays in Cocoa Beach, and then we're here Monday, Wednesday, and Thursday in Melbourne. We're on Wickham Road in Melbourne.
Okay, so Dr. Alukonis, you can find him at 401 North Wickham Road in Melbourne, and also at 1727 North Atlantic Avenue in Cocoa Beach. If you want to give their office a call, 321-425-2519, and you can check out more information on their website, spacecoastadvancedhealth.com. Thanks so much for joining us today. We appreciate all of the positive health news and things we can do to just stay healthy, not just right now, but going forward as well.
I appreciate it. And if any of your clientele have questions, they can call me. And if they want to speak to me personally, they can just ask the staff. So that way they don't have to feel obligated to come in. If they want to know can I help something or not help them. So feel free to call me. They can talk to me personally.
That's great. Thank you so much. And thank you for watching this video, everyone. Be well, stay connected.